A patient presents to the emergency department saying that he has severe chest pain. You ordered ECG, but the ECG is normal. On history, patient says that he was drinking chilled coke when he suddenly developed this kind of chest pain. Remember, this is diffuse esophageal spasm. You would order barium studies, and those studies would show corkscrew pattern of the esophagus. And the treatment of this diffuse esophageal spasm is calcium channel blocker. And ask the patient to prevent future drinking of chilled cold drinks.